morning, everyone.
Morning.
Can everybody hear me? Azure, can you hear me?
Yes.
Very good. Good morning, ni hao. So I think before we get started, I'd like for everyone who's participating in the session as an audience member to please mute your microphones and turn off your cameras. I want to make sure that we allow Ms. Azure Duan to be properly highlighted as a speaker on your screen. And also, I'd like to invite anyone who has a question throughout the meeting to click on the chat icon in the bottom of your screen. And once the chat box pops up to your right-hand side, feel free to type in your question in that box. And once we get to the question and answer portion of the event, I'll go through the questions and I'll ask a few to Ms. Duan. We won't have enough time for all of them, but we'll try to do the best that we can. So first, I'd like to introduce myself quickly. So my name is Paulina Guzman. I am the Global Engagement Officer for the Mayor's Office of International Affairs at the City of Atlanta. We are incredibly delighted to join together today in honor of Asian American and Pacific Islander Heritage Month by highlighting the teachings and traditions of Chinese traditional medicine, a practice that's truly central to holistic healing in the Asia Pacific region and beyond. I also wanted to send a special thank you to Welcoming Atlanta, the Confucius Institute at Georgia State University, the Asian Pacific American Heritage Month Advisory Board, for all your support of this program and all the virtual events that we have been organizing throughout the month of May. Again, the City of Atlanta is committed to celebrating the achievements and contributions of the Asian American and Pacific Islander community, whose presence truly does enrich the cultural and economic fabric of Metro Atlanta and across our state. I would also like to emphasize that the City of Atlanta does stand in solidarity with members of the AAPI community who have experienced harassment or violence that has been motivated by the COVID-19 pandemic or otherwise. Now is truly the time, that we do our part to stop the spread of discrimination, bigotry, stigmatization, and any sort of racist misinformation that's out there. With that said, I think we can go ahead and get started with our discussion. But first, I'd like to briefly introduce Ms. Azure Duan. Ms. Duan is the owner and practitioner of Harmony Acupuncture TCM, which is located in Duluth, Georgia. She is also a certified and licensed acupuncturist in the state of Georgia, as well as an instructor at Atlanta University of Health and Sciences. Ms. Duan is a medical editor and translator, and of course, she has become a specialist in the teachings and practice of traditional Chinese medicine throughout the years. So Ms. Duan, in your years of experience with the practice of traditional Chinese medicine, can you provide us with an overview of the practice and the teachings of Chinese traditional medicine? And can you also provide us with a bit of detail on how you distinguish between Chinese medicine and Western medicine?
Yeah, sure. Thank you. Thank you so much, Paulina. Let me bring up my PowerPoint because that'll be easier for the audience. And let me share my screen first and go to the PowerPoint. Okay, so can anybody see what's on the screen?
Yes, I can see the screen.
Okay, okay. So let me see here. Okay. I think a lot of you have seen this picture. Seen this scene in the Kung Fu Panda 2. I love it. I mean, it's funny. This is not actually how we do acupuncture. We don't stack too many needles. Okay, so poor panda. Alrighty. First of all, to answer your question, I'm going to give everybody an overview of traditional Chinese medicine. It is a healing system, of course, originated in China thousands of years ago, about 4,000 years ago. Then through years of accumulation of the knowledge and practice, finally, it just came to maturity in about 2,000 years ago, which a great book was written by many different physicians in Chinese medicine and establish the foundation for Chinese medicine. The book is called Yellow Emperor's Inner Canaan. In Chinese, basically, you can pronounce it as Huang Di Nei Jing. That's about 2,000 years ago. So it has set the theoretical foundation in how to treat people, how to prevent diseases, and the modalities of Chinese medicine, and how organs are working in harmony with each other. How disease would happen if the balance of those organs or the relationships was interrupted. Alrighty, so let me give you more the overview of the core theory used in traditional Chinese medicine. A lot of people hear about yin yang and five phases. Those are the philosophic ideas that are borrowed from Taoist philosophy. But the core theory we use in diagnose and treating diseases is actually the Zangfu organ theory, and then the meridian or channel and collateral theory. Meridians and channels are the big pathways which the blood and then the qi, which is the vital energy, running through, and to nutrient the body and to help people from being attacked by pathogens. And the Zangfu organ theory is basically, you can see it as a black box system, which you gather information from observing this person by asking the questions, by look at the tongue, and then also pulse taking, whatsoever, and listen to the person and judge the energy level. And there are many, many ways in this observation, pulse taking, and inquiry, diagnostic process. You can gather the information and know what's going on, whether it affects your lung or affects your heart. So this is what the Zangfu organs about. You really have to know from the function level of the organs, not the autonomy levels. You have to know both sides. And so in 2,000 years ago, we already talked about the Yellow Emperor's Inner Canaan. The other books that are very important, it's for treating the exteriorly contracted illness, basically infections. So there are two categories. One is the cold nature, what we call the cold damages. That sets the foundation for treating externally contracted illness of cold nature, which include, say, common colds or some flu that are not very severe. And if it's severe, then it's a different issue, which we had the foundation that came into maturity about 300 years ago with the establishment of the worm disease, which is like more serious infection or affected diseases. And for the internal diseases, the treatment and prevention system was matured also 1,800 years ago. Those classic formulas were recorded in a book called The Practical Formulas of Gold Chamber. And now let's discuss some of the characteristics of traditional Chinese medicine, or sometimes refers simply as Chinese medicine. First of all, unlike the Western medicine, is holistic. by holistic, we mean that, first of all, the person is a inseparable whole. It's a microcosmos living in the great cosmos. So everything will affect the person's health, like the, from the genetic composition of this person, the health of this person's mother and father, in the working environment, also what does this person eat, weather, etc. So this is the holistic view versus the reductionist theory based that's Western medicine based upon. Secondly, it borrows some philosophic concept from the Taoist philosophy, including the theory of yin and yang. Yin and yang is nothing that mysterious. It's a simple idea that developed from observing, which side of the hill is facing the sun and which side of the hill is on the back of the sun. So the one that's facing the sun is the yang side, and then the one that on the back is the yin side. And that concept, that observation expanded to a lot of things. For example, it can also be like two opposite objects or phenomenon, but are interrelated to each other. For example, the day and then the night, light and darkness, hot and cold, female and male, etc. And 5 phases basically describe the inner relationship of our Zangfu system. And it's an analogy based, okay? So it's not saying that your heart is the fire, but it just say that for example, the heart jumps a lot and it looks like a flame, so it has the property of the fire, etc. So it's basically analogy. And also the theory of essence and qi. Essence is basically the very basic material that composes the whole universe. And qi is the energy that are produced by those essence. And then the third characteristic differentiate Chinese medicine from Western medicine is what we call pattern differentiation. We don't look at the disease, just the disease, but we look at basically several aspects of this disease. For example, what's the cause of it? The cause has basically 3 categories. First of all, it's the internal. For example, you have a lot of phlegm that you cannot, clear up by yourself. That's, one of the internal factor, or stagnation of the blood in some area, or the sufficient qi, which is the internal causes. And then the external causes is any disturbance from the nature. For example, excessive wind in the springtime, you don't cover yourself very well, so your pores are open, the bad stuff get into you. That's the external causes. And then there are causes that are neither internal or external. For example, you were hit by a car, that's a trauma, and or you are bitten by a tick that causes diseases. So there are 3 categories, big categories, and then there are other categories. For example, emotional changes too. So those are the causes of the disease. And then the nature of the disease, meaning if you have a fever, that's a heat pattern. If you have a diarrhea, that's a dampness pattern. If you feel cold, even by wearing more clothes than other people, you have deficiency of the yang energy. So that's the nature. So basically hot and cold. And then also the nature is exterior pattern versus internal pattern. Exterior means if you are sneezing, tearing, and then runny nose, that's more towards the surface level. The disease is towards the surface level, versus you have a diarrhea, it's more on the, the internal level. So that's the nature. And body area, which organ does it affect? If you have cough, of course, it's the lung, basically the lung. If you're having runny nose, the lung opens at the nose. So of course, that's the lung. And if you have pain in your body, and we will see which meridian it is. So that's the body area, and then the organ. That's the third aspect we're looking at. And also we look at whether the healthy qi of your body that are stronger versus the pathogenic factors are stronger, and the tendency of those two forces. Those are very important in prognosis. For example, if the person is very strong and has sufficient healthy qi, even this person is affected with the disease, the prognosis will be good. She or he will recover sooner than those that have, like a lower level of healthy qi. Healthy qi means the healthy energy that defend yourself. Okay, so this is the picture that I made. Saying the person in the middle is a microcosmos living in the big cosmos. So everything affects us, and then it might cause imbalance if this person cannot adapt. And this is a picture of yin and yang. You see the dark area represents the yin aspect, which is the material foundation. And then the white, basically represents the yang, which is the function. So if you don't have enough material foundation, you cannot perform the function. And vice versa. And if you don't have enough energy, you cannot transform those, material foundation to energy or to maintain and to perform the function of your body. And this is the 5 phases model, which I'm not going to get into the details. Okay, the modalities of Chinese medicine, basically we use herbs, acupuncture, and moxa. I'm going to talk about it later. Tuina, cupping, therapeutic diet, food therapy, lifestyle changes, Tai Chi, Qigong, and psychological intervention. We do have that, but in the way of Chinese medical theories. And these are the picture of the forms of the herbal medicine that how you take. On the left lower side, it's the traditional form. You just put those together, with certain rules, and cook them into tea. That's the, well, I shouldn't say more traditional way, because we also have like a small, like a round kind of pills from the ancient time. But that's what a lot of people believe. That's the very traditional way. And we can put the powder into the capsule. It can be solutions, especially for children. You can make them into syrup. Okay, I love this one. This is a lot of people don't know that acupuncture has been used by U.S. Army since the first Gulf War. And they developed a model called battlefield acupuncture. So you just stick needles to certain points in the air, the airs, and to help them reduce the pain, and especially for soldiers that experience trauma in their service. And I can skip this part. And this the left picture shows another modality called cupping. And the one on the right, the upper right, is the moxa bastion, which you use moxa, and you use a piece of ginger or other material, to prevent the person from direct burn. And the lower right is a scraping. So this is me doing Tai Chi. Yeah, okay. This is right from the NIH website, showing the increasing trend for using herbs and other alternative way, yoga, Tai Chi, you name it. So Wow, did I run out of time?
Well, I think this is actually sort of a great transition, especially since you just previously showed the slide with the cupping application, the gua shao, the Tai Chi. But yeah, I mean, I think your overview was so excellent. It really was captivating to me how sort of the human body and the physical, the physicality is sort of viewed as an inseparable whole that is, affected by both the exterior environment as well as the internal environment, and that you sort of, in Chinese medicine, you look at all aspects of health to sort of understand the symptoms rather than just looking at the disease itself. But yeah, no, I think it's a great transition. I think most of us have really become more familiar with traditional Chinese medical practices like acupuncture, herbal solutions, even Tai Chi. But I think more recently, there really have been some practices that have become more mainstream. As you showcased the cupping, we saw Michael Phelps, the Olympic swimmer, who sort of popularized the usage of the cupping method. I know I've seen influencers on social media and Instagram using the gua sha tool, which sort of scrapes your skin to stimulate circulation and rejuvenate your skin. So that's something that I think has really become more mainstream. So I'm really curious if you can elaborate a little bit more on the application of some of these therapy techniques.
Okay.
So what are the similarities? What are the differences of each technique? And, what does the healing process look like?
Okay. With that, yeah, thank you, Paulina. You're a quick learner. So I'm going to show some videos that I gathered. Let me see. First video. Okay, so this is a video by Mayo Clinic. This person is a cancer survivor. He had operations, and then he developed severe nausea. And so this is how his doctor treated him. I turn off the, well, maybe I should.
Late at night, and it was completely debilitating. I struggled to keep my weight up. Galen's life was being controlled by the nausea. Neither diet nor medications could stop it.
Azure, I think the video it's unable to be seen.
Also,
oh, okay.
Your PowerPoint slides are still up on the screen, but not the video.
Okay.
So try again.
Okay, sorry about that. Okay. How about now?
No, unfortunately, we cannot see it.
Okay. Sure. Okay, here we go.
Yes.
Okay. Okay, so this person is a cancer survivor. And after operations, he has nausea, very severe nausea. So this is what his doctor's doing to him. Acupuncture. So it's very tiny needles. Yeah, this doctor in Mayo Clinic has studied in China. I guess, yeah, so that's the acupuncture. They also, there are a lot of researches has done in terms of acupuncture. So acupuncture nowadays is actually evidence-based. It's becoming mainstream. It's no longer the alternative medicine. So it's becoming mainstream. Okay, let me stop that. Stop this one. Okay. Now a video that I want to show you is the cupping method. So this is the traditional fire cupping, and there is the modern way that we, suction cups is also used. It's made of plastic, so you just use a pump to pump out the air. And this is very good for like muscular pain, and also like if people have common cold, they have a slight fever, you do the moving cupping on the surface of the body. It's very effective. And this one is scraping. I also have, I use, I bring this to show you guys how it looks like. It's basically very smooth piece of material. This is made of, I think, some sort of buffalo horn. Okay. Yeah, I think this person has Achilles tendon pain. So the practitioner is using scraping method to treat the patient. All right. Okay, so that's, and there's a really long one for Tui Na, considering the time. I don't know if I should show it, Paulina?
Yes, you have a bit of time, yes.
Okay, let me see here. Okay, so if anybody has questions, you can just, type it and then send it to me. The Tui Na one, I think this practitioner is Taiwanese. He's showing to his student, I think. So he will be speaking Taiwanese. Can you see? Paulina, can you see it?
Yes, yes.
Okay, okay. Yeah, he applied some, creams to reduce the actual dragging of the skin. And this is meridian style. So he works on the back meridian of the gallbladder meridian. Is basic. I think this person has herniated disc. So he's this is a starting portion of the Tui Na session. So for the starting, you really want to do some soft kind of a manipulation instead of the harsh ones. So the nerve can be stimulated, and then the pain threshold can increase for later on the more intensive treatment. Yeah. Alrighty. Okay, I'll stop here.
Well, that's great. I mean, I have a quick question before we go on to the Q&A portion. So when you are receive a patient that has a body ache or some type of ailment, how do you determine which technique to use? And do you also try to use multiple techniques?
Okay, pain, for example, first, they need to fill out the form, and then I will ask them the history of the pain, like where it is and how long it has happened. So I will determine whether it's just, acute pain versus chronic pain. And I will also ask them, the related health history to determine whether it's benign or something happened, like there is something growing to cause the pain. And if it's benign, then I will treat them, either use acupuncture or the Tui Na therapy, depending on their preference. So they can choose. Because some people are very scared of the needles. It takes a little bit of education for them to accept it. Although if it's practiced by an experienced practitioner, it's really painless. And yeah, Tui Na is also a good way of it. But you know, some people they don't like people to touch their body, so they prefer acupuncture. So it's both sides. You know, it depends on the practitioner, and it also the patient has a choice.
Sure. Well, great. Well, thank you, Ms. Duan, for the very comprehensive explanation and a video demonstration of some of the healing techniques. I'm sure, if we were having an in-person event, you would have been able to demonstrate, in a physical setting. But I think this works very well. So I'd like to ask the audience, if you haven't already submitted a question in the chat box, feel free to do so. We may not be able to get through all of the questions today, just simply because of time constraints. However, we're more than happy to collect the questions that we weren't able to answer, and then we'll respond to you after the meeting. So I think there are a couple of questions that are coming in, but before we get to those, I just wanted to ask you, Ms. Duan, so I think it's very striking to me how the traditional Chinese medical practice seems to, find prescriptions based around prevention. And you all, it takes a very personalized approach for the physical and also the mental state of the patient. Do you find that in Western medicine that this is true, or do you find that there seems to be more of a kind of like a one-size-fits-all prescription for health ailments? What are your thoughts on that?
One thing fits all. I guess even in Western medicine, it doesn't work that way. Because when they develop drug, they will see whether the drug has, can treat certain proportion of the people, whether it has like 60%, 70%, 80% of a successful rate, right? So there are still people that need more individualized treatment if they don't fall into those numbers, you know what I'm saying? So with Chinese medicine, it's the same thing. For example, for one disease, maybe the major pattern is one pattern, so it can treat 70% of the people affected with the disease of the same pattern. But maybe there are 30% of the people that are not in this ring. So you need to find out what really the pattern is. Even for a common cold, there are people who have heat pattern, but there are people who have cold pattern. Nowadays, heat pattern is dominant, but there is small percentage of them. I do have patients. If you use like cooler ingredients, it doesn't work. It'll hurt them more. They feel cold. So you need to use what we call the warmers to treat them. Yeah.
Perfect. Good. So I think we'll go to one of our first questions. So what is the best way, in your opinion, to treat insomnia by Chinese medicine?
Okay. So the best way, I will explain to you first. You have to look at a pattern, because in insomnia, the cause of it would be different. And then the length of the course is very different. For example, people have suffered them for a long time versus just happened recently. The treatment method will be very different. Basically, for insomnia, you also have to do a pattern differentiation. And you find the cause, whether it's from a lot of stress, then you use the points or the herbal ingredients to reduce the stress, and then the person can go to sleep. Or is it caused by pain? If it's by pain and then the person suffers from pain and cannot fall asleep, you treat the pain. So you treat the root cause, not just insomnia, not the name of the problem. Did I answer the question?
I think so. No, that definitely does make sense. Mm-hmm. So I wanted to also address a question from Vanessa Ibarra. She's actually the director of the Mayor's Office of International Affairs. Her question is, how do you think we can continue to elevate traditional medicine to become more recognized in mainstream medicine?
Yeah, so basically, the acupuncturist, licensed acupuncturist in Georgia, we are outnumbered by other healthcare workers. So, you know, from the education, we need to produce more of us, right? Secondly, we need the legislatures to make, you know, laws that are promoting acupuncture versus trying to, you know, like in favor of acupuncture and Chinese medicine. So it can be used, you know, more widespreadly and serve the mass population. Yeah, we are working on that. We need support from people like you, from the legislature, and then from people who are interested in Chinese medicine. So we need all of those support.
I agree. I absolutely agree. You know, I think it's always great to educate yourself on, you know, different practices, you know, different ways of taking care of oneself. And I think, you know, these types of events are great launch points to start the conversation, start the discussions.
Yeah.
So I think we have, oh, go ahead.
Yeah, I have one more thing to add. And actually, a lot of us has already been working with Western medical doctors. For example, I'm working with infertility doctors. They do IVF. The acupuncture and herbal treatment can increase the successful rate of IVF. And sometimes, even without IVF, we have, you know, examples of people, I mean, of women get pregnant just naturally after getting the treatment. So it just brings up the overall successful rate. And, you know, I mean, it's more beneficial that we're working together.
I think so, and I think you brought up a good point. You know, throughout some of my research, you know, I tried to watch quite a few videos to educate myself a little bit on the practice of traditional Chinese medicine. And, you know, of course, there are some skeptics out there that sort of question the safety of prescribing, you know, these types of things without clinical trials. You know, is it really a placebo effect? Like, what's really going on behind the scenes? So I think, you know, doing these types of things, partnering with, you know, general practitioners, partnering with the medical community, and finding forums and platforms to discuss the proved benefits and results that positive results that have come from traditional Chinese medicine, I think it's a great starting point.
Yeah, yeah, I heard you use the word placebo. So you did do some researches. That's great. And actually, it's true for both the Western medical doctor. I mean, at least some of them, and Chinese medical doctor. We do use placebo effect as addition to the treatment effect. For example, if you present a very good and welcoming attitude towards your patient, they heal quicker, believe it or not, you know. So we had to use it. But the treatment effect is something we need to discover beyond the placebo effect. And there are a lot of experiment has been done at the research level with mixed results. Sometimes I see that as maybe their technique is not quite there yet. I don't know. I mean, so we just need to have more researches done in those fields to see whether it's just placebo or something more than the placebo.
Sure, absolutely. I think there's one more, there's a couple more questions. I'd like to address one by Mr. Jorge Fernandez. He's asking if you have a list of recommended practitioners within the city of Atlanta limits, and perhaps after this meeting, we can share a list to everyone who registered for the session.
Well, I can't say recommended practitioners because it's not really a job as a practitioner to see who is good at what. But I can tell you you should always look for those who are certified by NCCAOM and also have a legitimate license with the state of Georgia. So you can go online and search Medical Board of Georgia, and then go to the look up a practitioner, like a software app online, and select acupuncture and see who's actively practicing.
Perfect. That sounds great. And then I think just one more technique-related question about the video on gua sha. Should the direction be from top to bottom, from head to foot? Are there different methods of doing gua sha than what was demonstrated in the video?
Well, actually, in practice, in theory, some old theory would tell you from top to bottom, but that one that we're seeing is localized illnesses. It's not something in general. So the practitioner did some stroke from the bottom. I think that's fine.
Okay, very good. Well, I think that's all the time that we have for questions. Ms. Duan, I really would like to thank you immensely for volunteering your time to speak with us today. I think before we end the session, would you like to provide any closing thoughts?
Well, yes. I think the future of medicine, it's not going to be Western versus Eastern. And we already see a trend. I have some slides that I didn't show you. That some major institute, for example, the Yale University, the Cancer Institute of Yale School of Medicine, and then Pittsburgh, University of Pittsburgh, the School of Medicine, they've already started to discover, how the 1800-year-old formula can be benefiting while used in conjunction with chemotherapy to treat cancer patients. So that's a great trend, and we should have, the practitioners versus people that are in the research field working together. And someday, I believe there won't be Western medicine and Eastern medicine. They should be integrated medicine. So integrated medicine will be the future of medicine.
Absolutely. We hope for that as well. So thank you again. I think that's a great way to end the session. But before we end, I just wanted to remind everyone who is listening in that you will receive an email with Ms. Azure Duan's contact information, as well as a website link to Harmony Acupuncture and TCM, in case you're interested in visiting her practice. As well as the contact information and social media handles from all of our partners, the Confucius Institute, Welcoming Atlanta, our office as well, so that all of you can keep up with our virtual events and programs that we have coming up in the next few months. Next month, we will be celebrating Immigrant Heritage Month, so stay tuned for more information. And thank you again to the City of Atlanta, to Welcoming Atlanta, of course, the Confucius Institute at Georgia State University, the Asian American and Pacific Islander Heritage Month Advisory Board for all your enduring support and activity throughout this month and beyond. And thank you all to everyone who attended the session today. Have a great afternoon.
Thank you, everyone.
Thank you.
Thank you, Paulina. Thank you, everyone.